Hello, everyone, and welcome to our debate about gift giving and applied behavior analysis. We will start our debate today by talking about our group members. First off, we have Brianna Olden, who we will refer to as Bree within our presentation. She is our stater and prover on the pro code side. We also have Brianna Wildermuth, who is our attacker on the pro code side. Valerie Jimenez will serve as our stater and prover on the con side against the code. And I am Michelle Madison. I will serve as our moderator tonight, as well as the attacker on the con side against the code. Giving an applied behavior analysis is against code 1.06. Tonight, we will discuss gift giving through a formal debate with a scenario discussion at the end. 1.06, due to the potentially harmful effects of multiple relationships, behavior analysts avoid multiple relationships. Behavior analysts must always be sensitive to the potentially harmful effects of multiple relationships. If a behavior analyst finds that due to unforeseen factors, a multiple relationship has arisen, they seek to resolve it. What this code means is that if a behavior analyst engages with a personal relationship with a client or family, they are creating a multiple relationship, which may in return hinder their ability to ethically treat that client. A behavior analyst is ethically bound to create the most effective and evidence-based treatment possible for their individual client. Gifts within our debate have a few meanings. Gifts can be concrete or symbolic. Gifts could include a poem, card, homemade meal, a slice of birthday cake, a flower from a young client or even an older client, a book, a gift card, or even simply a glass of water from a parent or caregiver. It's important to remember that the meaning of gifts needs to be understood, and it can't always be within a therapist-client relationship. Within our debate tonight, you will hear us discuss multiple factors. Those will include the intent versus impact of a gift, therapists and families, favoritism, equality versus equity, if a relationship can impact a treatment, cultural boundaries, as well as professionalism. Throughout our debate, we will discuss multiple points of view on if behavior analysts should be able to accept gifts like many other professionals. To open up our debate tonight, we will hear from Bree, who will discuss the pro-prover opening remarks.
Hello, as Michelle stated earlier, my name is Brianna Olden, and I will demonstrate the pros to code 1.06 in regards to gift giving. Clear boundaries between the client and provider. If both the provider and client and proactive measures are taken, there are clear boundaries. As Emily McCulloch stated in Behavioral Science in the 21st Century, be proactive. You and your agency should send an email to clients and parents informing them of the code of ethics and that no gifts will be received. This may prevent awkward situations for you and your staff. In doing what is advised by Emily, the information is already available to the client and there is no urge to try and bring gifts. The client know what is expected of them, and if they try to cross the line, the issue will be much easier to handle because they knew the rules and decided not to follow them, instead of not knowing in the first place. Blanco advises that one should not accept gifts or give gifts. It is better to express this rule to parents at the beginning of your relationship, rather than when they are handing you a favorite coffee shop. While parents want to show appreciation and care for you, gift giving on either end blurs the lines between a professional relationship and friendship. Thank you is more than enough to demonstrate gratitude and keeps the lines clear. Brown and Transgrid sum up this point perfectly in the following quote. Psychotherapists gifts from their clients because gift accepting of any kind endangers the therapeutic relationship. Favoritism cannot be shown through gifts if this code is followed. To certain clients or therapists, depending on who the gift is given to or from, and specifically when thinking about an ABA center, it's a gift to one therapist or a certain small group of therapists, the other therapists in that center may feel like they are not good enough for the family. Those therapists in turn may start to provide less than quality therapy to that client, whether they realize it or not. And if a therapist or group of therapists decide to give gifts to a certain client, the other clients may feel offended. Once other clients or their families find out that one has been singled out and given what could be seen as special treatment, the others may feel like they aren't getting the best services possible. Feel as though only one client is getting quality ABA therapy because he or she is the only one the therapists like. Even if all therapists or all clients in the reverse situation, it may start to become expected that they get gifts for holidays or randomly throughout the year. In the case, people could become upset, thinking that they don't matter anymore. To shed light on this topic, Schultz states, gifts, even if given of one's own free will, are not without strings and expectations that they will be reciprocated. Although that quote by Schultz seems a little harsh statement, it is often the reality for many people. For gift-giving holidays, it is often the case where someone gives a gift and they expect to receive one in return. Following this code, ideally, every client is treated equally because multiple relationships have not been able to form. Proactive in not allowing gift giving to happen, multiple relationships can be avoided and make the work environment much simpler. Many conflicts can be avoided by sticking to the code. Schultz again iterates that powerful psychosociological forces that lead us, whether consciously or unconsciously, to action to favor a specific person or position, or to reach a deal. It creates a sense of dependency that invites reciprocity and duty not discharged until the favor or gift is somehow repaid. If the client gives you a gift, it could come with the thought that they got you something. You will provide better services to them or more attention to that particular case. Brown and Transgood state, well-intentioned boundary crossing progresses over time into major violations that are harmful to clients and place the therapeutic process in jeopardy. A simple gift of a drawing or small monetary gift card can turn into larger items. Giving the gift of a night off and babysitting a client can possibly lead to multiple relationships. Families don't feel obligated to give gifts or thank ABA therapists when following the code. Once a family buys a gift for a therapist, they may start to feel obligated to continue buying the gifts for the holiday or just because. That way the therapist continues to feel thanked and provides quality service. It is hard to know the intent behind the gift. A small token could be romantic for a client or a family member and create an unprofessional relationship. For example, a bunch of flowers with a thank you card as appreciative or the start of romantic feelings. It's hard to determine. Blanco and Moore bring about an interesting light to this topic. Solve a personal problem through the use of a gift. In accepting gifts from the previously stated child, it could be teaching the client poor coping skills, and that flowers or gifts would solve any problem, but unfortunately that isn't the case. So this topic from a similar perspective as Blanco and Moore. If a narcissistic patient often uses expensive gifts to bribe or manipulate people in his or her personal life, then the presentation of a gift to a psychiatrist would raise clinically important questions. Careful exploration of the intention and meaning of the gift, regardless of whether the psychiatrist ultimately accepts it or refuses it, is necessary. McCulloch leaves us with one important idea, that the BACB also recognizes that it is important to acknowledge the gesture and thoughtfulness of. We should be careful how we explain the ethical code as to not imply that the gift may have strings attached to it, and that other professionals who accept gifts are less ethical than we are. Only that we are grateful for the kindness they show and the trust they put in us. Although as clinicians we should follow Code 1.06, it is important to remember that the client took time to provide or create a gift, and it should be noted, but ultimately a gift should not be accepted in order to maintain professional relationships.
Thank you, Bree, for opening up our debate. Next, Valerie will respond with the con side as the approver.
Hello, I'm Valerie, and I'll be explaining The con side. First off, as a group, we determined that people are human and enjoy getting to know the people they work with or see regularly. For example, if you get coffee 4 times a week, you get to have friendly conversation with your barista or the checkout clerk at a local grocery store. Alongside of this, it's common for people to feel invested in this work and begin to care for the families or client. By having a 5 to 10 check-in with a family, you may be asking them how things are going, how they're feeling, how school was, and learn that this change may impact your client. For example, maybe a single mom has a new partner, maybe a grandmother moved into the home, school may have a new teacher due to a leave of absence. All of these situations are important factors to note that could be phase lines on our client's data. Without having a relationship with the family, we would be unable to gather the information we need to understand why a change in the behavior occurred. There are factors besides med changes in sleep that affect clients. Other cultures may get offended when you say no to a gift. We will discuss this with a specific example at the end of our debate. Trust is built with the family. It's hard to build trust if you can't talk with them about life and to get to know them. Demonstrated that humans have a natural disposition to trust. Trust can be related to relationships between people such as friends, colleagues, families, companies, and organizations. Especially when working so close to a family for the betterment of the patient, it's almost required to understand the environment the patient lives in. Its lifestyle, family traditions, hobbies, and ideas. Topics can create a blurred line leading to establishing multiple relationships. Creating a boundary where the conversations between the clinician and the family are strictly treatment related can almost create a feeling of distance. When working towards the goals for the patient, it's important the family feels close to you and trusts you to have the best interest for their child. The child too must feel a closeness to trust you and move forward in complying with objective tasks. Therapeutic techniques used by the therapist are not always directly correlated to the effectiveness of the treatment. Rather, it's the relationship bond that develops between the child and the therapist that is a determining factor in successful outcomes. Part of getting to know the person you work with on a daily basis is getting to know their background history, which is sometimes hard when there's limited communication amongst the family, the ABA therapist, and the client. As the therapist works with the client several hours a week, every week for the duration of their treatment, it's almost considered common courtesy to open a line of communication where you get to know the person. This includes the patient and their family. You begin to discuss background history, obstacles they may be facing because of certain behaviors, their feelings of embarrassment, desperation, and guilt. They may become vulnerable and truly feel as though you may be the only person who can help build a positive outcome during the difficult times they've experienced with the targeted problem behaviors. Limiting communication on discussing crucial to understanding may create a barrier where treatment might not be as effective or may take longer than expected because of the lack of understanding. Good therapists with appropriate boundaries often do not view the evolution of closeness of the change in the therapeutic relationship with the potential for a friendship after the therapy concludes, as some clients may. It's not always the therapist that wouldn't like there to be a friendship in some instances, nor does this mean they don't care or are indifferent towards their patients. Other professionals can accept gifts, such as doctors, therapists, lawyers, teachers, and even judges. Why is ABA the only field not allowing it? All of the above professions deal with ethics and building positive relationships. It may be easier to draw a hard, fast line and say no to gifts whatsoever, but is that really the best option for the therapist and the family? Within ABA, we teach social skills and appropriate communication. Gift giving is something that occurs regularly in different capacities within our cultures and society. This could be a teachable moment and open to the therapist's judgment. so long as the gift does not affect a person's independence, integrity, or impartiality, it is allowed. A judge can accept social hospitality cards, books, etc., without publicly announcing it. We give gifts to clients. Is it realistic not to allow a family to do something similar? And transitional objects for clients and families. A family on a beach vacation may get a CD and social story from the therapist. When on the trip, they may bring back a rock or some sand as a gratitude to the therapist for helping their child be successful in that environment. This could be upsetting to a family if you refuse. Appropriate therapist gifts to clients may include a symbolic gift, a card that has a meaning to the client, a gift that serves a transitional object, a rock from an office rock collection, a note from the therapist with a specific saying as a way to help a client who is dealing with anxiety, or therapy-related educational materials, such as a CD on mood swings for a bipolar patient. Following social convention, acknowledging a gift, a smaller symbolic graduation or wedding gift, a supportive, reassuring gift, such as giving a flashlight to a patient who's going on his first overnight camping trip, or an affirmation of the relationship, a small symbolic souvenir from a trip abroad.
Thank you, Valerie, for discussing your point of view. Next, Brianna will discuss the pro side as their attacker.
Hello, everyone. I'm going to bring us back to the pro side of this debate to give some statements defending Code 1.06. Gift giving between client and professional can create confusing relationships for everyone. The families should already know from the beginning of the professional relationship that gifts will not be given or accepted. If everyone follows the code and is proactive in their approach, we should not have to say no to a gift or offend someone from another culture. It is very possible to care for clients and their families without forming these multiple relationships. Trust can be gained between therapist and the client and family while keeping the professional relationship. It is our job to talk with the family about the client's best interests and goals for the future, but it is not our job to become best friends with the family and spend time with them outside of the professional environment. As a BCBA, we can meet with our clients' families to discuss better ways to help the client. These meetings alone can help build trust and a sense of belonging as the BCBA and parents or guardians discuss home life and intervention options to better the client's life. We do not have to decrease our communication with families, rather we should be smarter about our communication. The client is our #1 priority, so what other things would we need to be talking to parents or guardians about if it is not to help our client?
Thank you, Brianna, for discussing your points of view. Next, I will respond with our con side as the attacker. It's a natural thing people want to do for those that they care about. Clients more and more, we naturally want to have a relationship with them where we can freely communicate and not distance ourselves. Gifts shouldn't necessarily be encouraged at all times, but they shouldn't have to be denied. How are we going to stop every parent or guardian from giving the gifts? Today, we would like to discuss a few potential situations you might come across as a future BCBA and how we argue to accept or not to accept that gift. The first situation we would like to discuss is equity versus equality. Equality is giving everyone the same treatment and the same thing. Equity is providing one person or that individual what they need specifically. I personally like to discuss equity and equality in regards to shoes. Equality would be giving the same person the same exact pair of shoes everywhere, the same design, the same width. This would be fair, but not everyone's shoes would fit, and their needs would not be met. Equity is giving everyone one pair of shoes that is the right size, width, style, and is tailored to their individual needs. Adding to this will be Bree discussing our pro code side.
So speaking from the pro side, if gift giving were allowed in ABA, what would you specifically do if a client's parent brought gifts to your center for only 3 out of the 15 therapists? This particular situation actually happened to me personally at the ABA center I work for. A parent brought in Christmas cards for 3 of her child's therapists instead, and inside was a monetary gift. These people did not accept the gift. However, from that point on, all other therapists that had been working with that child felt like they were not good enough or that that parent did not like them. So it caused many more issues, even beyond Christmas time. This type of situation is what the code is trying to avoid. Thank you.
I will reply as part of the against the code. A child may be in a classroom with 3 teachers. The whole school has 15 teachers in total. A parent might get a gift for the teacher to appreciate them that their child and worked with them. They wouldn't necessarily get a gift for every teacher in the school or all of the administration. Those teachers are able to accept those gifts, and it doesn't create an unequal situation because we as professionals aren't reading into situations and feeling unworthy. We don't expect gifts, but we should be able to make a judgment call if we believe a gift is acceptable and won't hinder our relationship or ability to treat a client. Discuss cultural boundaries within gift giving. I will open up our cultural discussion with our against the code conversation. I personally have worked with families that were new immigrants to the US from Nepal and Somalia. One of the families that sticks out in my mind was a family from Nepal. Culturally, it is expected that the children from a young age of 3, 4, sometimes even 5, start to learn to serve tea to guests in the home. We had a parent training and a home check-in with this specific family, and we were offered tea. We weren't able to accept the tea. This family in particular actually refused to stop allowing us to come into the home and do home therapy because to them it was disrespectful to not simply accept a cup of tea. At providing the best treatment for our clients, does it make sense to create a barrier and a boundary solely based on a cup of tea when we could have turned that cup of tea into a teaching moment and learned how do we make the tea, what are the steps involved, and created that as part of the therapy and treatment? We as therapists should have the ability to make a professional judgment onto what's the most appropriate way to build rapport with a family and not cause a treatment barrier due to something like a small cup of tea. I'll respond as the pro side to the cultural barriers.
As I defend the code, I would say who gets to decide what a small gift is, such as a small cup of tea? Something as simple as this cup of tea could have the same effect as a more expensive gift, such as a bottle of wine or chocolates that someone tries to bring into their BCBA. Although we may not think a gift is creating a multiple relationship in that moment, in the back of our minds, it could be altering the way we treat our clients. We could be subconsciously providing better treatment to our clients that give us gifts over the ones who don't. It is better to lay out the rules and guidelines at the beginning of our professional relationship for all clients, regardless of the culture.
Thank you, Brianna, for your response. Next, we will bring our final scenario, which discusses if accepting a glass of water is professional or unprofessional with an ABA, and if accepting that water could create a situation that would impact our treatment. Bree will discuss our pro code's point of view.
So one might ask, why shouldn't we accept a glass of water? But in accepting water from a client, it seems like a simple, harmless act. But here's where it gets tricky. Say you accept a glass of water from one client after a long day. Or the same client then has the idea to get you a cupcake for the next day because of your hard work. As time goes on, more expensive gifts could be given to you by the client because you are open to accepting them. Arise with certain clients believing their trust in adequate treatment compared to the client who can afford fancy gifts for the BCBA. Point, you might actually be treating clients unfairly because of feelings that have developed about them.
Thank you, Bree. I will respond with the con side. A glass of water doesn't have to turn into something more. You can politely say no to another gift that might arise. When we think about water, it's a natural resource that is readily available to us throughout our days and different environments that we come across. If you're in a school and there's a fountain, you can fill up your water bottle. So what's the difference of filling up that water bottle in a school or filling it up in the home? The other point of view is, say you're really thirsty, you've drank all your water because you've been all gone all day and your throat's parched. If you're conducting a therapy session, it might be really hard for you to talk to the client that you're working with if you have to constantly clear your throat, and a simple glass of water would make a better therapeutic session. So when we're working on teaching speech and various therapies to our clients, we need to give them the best treatment possible, and a simple glass of water could be all you need. However, according to the ethic code, you couldn't ask for that water. Thank you, everyone, for your thoughtful comments and conversations about our scenarios. About our debate tonight with the concluding remarks on the pro code and against the code side. We will start with Bree, who will close out the pro side with their concluding remarks.
So, although a simple item as a picture a client drew or an extravagant piece of jewelry, accepting a gift of any sort from a client is against the ethical code behavioral analysts thrive to uphold. Items or materials from clients, the relationship between the clinician and client is jeopardized. Favoritism amongst clients, and it creates an unfair advantage in ideal of services for the client that had provided the gift. When a clinician refuses a gift, it ensures equality amongst clients. It keeps the valiant in clinician, and there's no need to worry about lines being crossed.
Thank you for your concluding remarks, Bree. Next, we will have our con side closing out their concluding remarks by Valerie letting us know.
When working closely with people every day for a certain amount of time, it's human nature to build a close relationship. This is against the ethical code behavior analysts are responsible to hold. It is an unrealistic obligation. Being able to accept gifts from patients and their families builds rapport, trust, and a closeness that can provide positive results. Building a close relationship with a family and the family creates an easier environment. Together, results are obtained at an accelerated level. Denying gifts from patients and their families creates distance and a boundary in which will be difficult to overcome, as the patient may not feel a level of trust moving forward. Resource, the national psychologist, gift giving is an ancient and universal way to express gratitude, appreciation, and love. In therapy are ethical and enhance authentic therapeutic relationships, which is the best predictor for therapeutic outcome. Appropriate gifts from children to therapists or therapists to children are very common and clinically appropriate. Therapists do not need to always explore the meaning of the gifts with clients, but rather embrace the trust and relationship that has been established with the patient and the family. We would all like to take a moment to thank you for watching our debate. This was a much debated topic within our group, and we really enjoyed discussing. We felt this was a great topic for discussion, and it will impact our futures as hopeful BCBAs. We look forward to your comments and input. Our question for the class is, any arguments for or against the code 1.06 we haven't touched in our debate? Thank you, and good luck to those who are still working on your debates. Thanks. Bye, guys.